Hello everyone, I hope you all are doing good. Welcome back to my series on Step 2 CK preparation. Today we have a very simple, very small topic, but this is very simple, very easy, but you have to consider it before going into this Step 2. So what happens is, like, in a lot of question stamps, we have question like other carrier status for autosomal recessive disease. Okay, for example, if we take TSX disease, we are going to write T and T for the genes. So T is the dominant allele and T is the recessive allele. Okay, so what happens is, that the mother has like this status, so you don't know if the baby is going to acquire it. So the question stem is going to ask you what is your next best step in the management. So what you do is, like, you do not go directly to chorionic villus sampling or amniocentesis. First, what you do is there's a few protocols that you have to follow. So what happens in TSX is, like, it's a fatal disease, therefore it's important. Okay, for fatal autosomal recessive diseases, the screening is very important because the baby is not going to be able to live. So if the patient wants to consider abortion or something like that, what you do is, like, you go for maternal genetic testing. If the maternal mom is like negative, so it means she has like T, then you do not do further testing, you do nothing, right? If the mother is carrier like this, then what you do is you go for the paternal genetic screening. If the father is not a carrier, so he has like T, even if the mother has like T, then there's gonna be no babies with Tay-Sachs. Okay, why I'm saying that? Because if you have T, and T, what happens is, like, just like small t big T, then you have small big T and small t big T. So you have 50% chance of like a normal baby and 50% of a carrier baby. So you're not going to have a baby who is going to be born with TSX. Okay, so what happens in this case is, you again do not do any further testing because this baby is going to survive and there's going to be no problem for this baby. But if the paternal genetic screening comes positive, means he's also a carrier, you go for the fetal testing because you might have a baby who has Tay-Sachs. Okay, why? Because in this case, what happens is, you have TT and TT. So what happens is, like, TT gives you normal, big T, small t, again carrier, big T, small t, again a carrier, and a small t and small t is going to give you TT, which is like the Tay-Sachs disease. So in this case, you're going to have baby who have Tay-Sachs, and the baby might not survive into adulthood because the Tay-Sachs disease, what happens is, like, GM2 gangliosides, they store in your brain, in the lysosomes inside your neurons. So the baby dies of neuromuscular problems and behavioral changes and respiratory paralysis and muscular paralysis. So therefore the patients might terminate the pregnancy. So this is a very simple concept, everything. Okay, so this is all for prenatal autosomal recessive disease screening. See you in the next video.